Onc Live Insights is a video editorial program produced by Onc Live.
Another area to pay attention to is actually novel monoclonal antibodies. So among those, obinutuzumab is being studied now in lymphoma field. As you probably know, obinutuzumab has been FDA approved for use in chronic lymphocytic leukemia in combination with chlorambucil. So this is a novel anti-CD20 antibody that's a type 2 glycoengineered antibody that increases the Fc binding affinity. And because of this modification, obinutuzumab does have a stronger ADCC activity that's leading to a more efficient tumor killing compared to rituximab. In the CLL-11 study that compared the combination of obinutuzumab with chlorambucil versus rituximab plus chlorambucil, obinutuzumab combination showed prolonged progression-free survival as well as improved response and the quality of response, demonstrating that this novel modified anti-CD20 antibody is superior to rituximab. So in the lymphoma field, there is a study that's being reported in this ASH meeting by combining obinutuzumab with chemotherapy. In this ASH meeting, there is updated reports of a combination of obinutuzumab with chemotherapy backbone in follicular lymphoma.
The Catalan study was a very important, very exciting phase 3 trial conducted in rituximab refractory follicular lymphoma. The design was that patients received either bendamustine at a dose of 120 milligrams per meter squared on days 1 and 2, or bendamustine at a dose of 90 milligrams per meter squared on days 1 and 2, plus obinutuzumab. The combination arm was also followed by maintenance obinutuzumab. And there were some interesting observations. The first was there was no difference in overall response rate by the end of induction therapy. However, the primary endpoint was progression-free survival, and it was significantly longer with the obinutuzumab with a hazard ratio of 0.55 without much in the way of additional toxicities. And this study has the potential to alter how we approach patients in this context who did not receive bendamustine rituximab as part of their initial treatment. Obinutuzumab is an interesting monoclonal antibody, anti-CD20. How it will fit into the overall management of follicular lymphoma remains to be seen. In a head-to-head comparison with rituximab in relapsed follicular lymphoma, there actually was no difference in efficacy. And this was recently published by Laurie Sain and her coworkers. But in the Catalan trial, adding it to bendamustine with maintenance had a marked improvement in progression-free survival, and we are waiting longer follow-up to see what the implications are this for potentially a survival benefit. We're way too early for that. So we're still trying to figure out, while we're trying to figure that out, we are now combining obinutuzumab with other agents active in the treatment of follicular lymphoma, other than bendamustine, some of the newer targeted drugs, idelalisib, ibrutinib, venetoclax, and others. So it's a very exciting time where we have new targeted therapies that may be more effective for improving the outcome of patients with follicular lymphoma.